Good day, everybody, once again. My name is Sarah Hess, and I work for the World Health Organization in Geneva. Welcome to everybody who has joined this webinar with a specific focus on the food sector, food security, and the protection of workers working in the food industry. I have some colleagues on the line with me and an invited speaker. I have with me Dr. Peter Ben Emberek, who is the focal point at WHO for the interface between the animal and the human concept for the COVID-19 pandemic. I also have with me Professor Alan Riley, who is from the University College of Dublin and former CEO of the Food Safety Authority of Ireland. We're very lucky today to have them on the call. We have received a large number of questions prior to this call, which we will try to answer and address at the end. We have with us a large number of participants. Unfortunately, because this is a meeting with many participants, the participants are muted. And we will try to, if you do have additional questions, please do put them in the Q&A function of the Zoom facility. Please try to avoid using the chat function because then it's very easy for us to miss questions there. But if they're in the Q&A function, we can capture these questions after the call and feed them into our products that we are developing. So I'm going to hand over now to Dr. Peter Ben Emberek. I have a presentation, so if you're joining this call from a computer, you will be able to see this presentation. Let me put it on now. Peter, over to you.
Thank you, Sarah, and good morning, good afternoon, and good evening to all of you, and thank you for joining us today. In the interest of time, I will start quickly by giving you a very brief overview of the current situation. As you can see on this slide, these are the current numbers as of yesterday evening, but as you all know, this is a very fast-moving event, and in fact, we have already passed the 1 million confirmed cases worldwide during the last few hours. And we have unfortunately also passed the 50,000 mark of deaths from this pandemic. You can also see here the countries with the highest number of cases in the past day and cumulatively, and these are the countries where the disease is spreading fastest as we speak. But we have to remember that all these numbers reflect the situation probably 1 week to 10 days ago, as there is a time lag between people getting infected and being detected and recorded and transmitted. So these are not the current situation in the real world today. Next slide, please. I will also give you a few information about where this virus is originating. These SARS viruses, these SARS coronaviruses are, and this one we are having in this pandemic belongs to a group of coronaviruses that have their ecological niche in the bat populations. Many of these coronaviruses can infect several species, and therefore it's not unusual that they jump from animals to humans, and sometimes can also infect animals from humans. And that's very important with regards to our animal food production. As you would remember, SARS infected first civet cats, which were farmed in southern China, and then from there jumped to humans. And in the Middle East, since 2012, the MERS coronavirus has been infecting humans from dromedary camels, and is still this one is still ongoing. All the genetic sequences we have so far of COVID-19 virus point to a single point introduction in the human population sometime during the last quarter of 2019. The analysis of those sequences also suggest or strongly suggest, in fact, that there is a natural origin of this virus. This is not a constructed virus. It's not a virus that has been made in a laboratory. Next slide, please. As with past events of this type, the start of infection in humans is often coming from a spillover from an intermediary animal host. It's very rarely that, and also very difficult for these viruses to jump directly from bat to human. First, because we don't have much close contact with bats, but also because the receptor cells in bats and in humans are quite different, and therefore there will be a need for too many mutations or adaptations for the virus before it can jump, and therefore jumping through another animal in between is much more likely and much easier for the virus to adapt to human this way. We know that in December there was a food market, large food wholesale markets involved in some of the first cases detected. We still don't know whether this is the source of the virus or whether it just played an amplifying role in mid-December. There are cases reported from before December, and therefore we still need to have this investigation in the region to figure out where and how the virus started. There have been also a number of susceptibility studies on different animals, meaning the animals were infected with the virus to see if they could get infected and transmit the virus. And the results so far shows that ferrets and cats can get infected and that cats can transmit the infection. And that's a very interesting discovery that was just made public a few days ago. So cats could, in principle, be this unknown intermediary animal host. We will need further studies to confirm that. Cats are considered as food both in and consumed widely both in China and other parts of the world. Even here in Switzerland, where I'm currently living, cat stew are not unknown. The studies also show so far that the virus doesn't replicate easily in pigs, chickens, and ducks, which are other common farm animals, and that's the good news. I will now hand it over to Alan, and Alan will take you through the next set of slides. Thank you. Alan, over to you.
Thank you, Peter, and hello, everybody. What I'm just going to do is run through a few slides here to talk about the guidance for food businesses that we have prepared. Essentially, food processors and food retailers, you cannot work from home. I mean, say the whole world is nearly in lockdown at the present moment. People are self-isolating, teleworking and so on. This is not an option for the food sector. And that is something that I think we have to remember. The food service providers are certainly frontline essential workers, and maintaining the movement of food along the food chain is really a critical function. And really it's critical literally to the survival of society as we know it. So there's a huge role here to be played by the food industry and each link in the chain of the food industry. We have standards in place, based upon food safety management systems, based upon the hazard principles, and all the prerequisite programs that underpin the food safety management systems, based upon the general code of practice for hygiene. All of those measures still apply, but there are some additional hygiene and sanitation measures that we need to introduce really, because of this particular pandemic. And really those are focusing on protecting workers in the food environment. Next slide, please. Really, the measures to protect food workers from contracting COVID-19, this is what's covered in the guidance: preventing exposure to our transmission of the virus, and strengthening existing food hygiene and sanitation practices. The whole purpose of the guide is to ensure that the integrity of the food chain is maintained and that adequate and safe food supplies are available for consumers. That's essentially why this guide has been produced. Next slide, please. I'm sure everybody has seen reports, both in the popular press and in scientific literature, that the virus can survive in different environments. However, it's really highly unlikely that people can catch the disease, the COVID-19, from food or food packaging material. This hasn't been reported to date. The virus is fragile, surviving outside the human body is a struggle for us, but certainly we've seen reports of it surviving on different surfaces, like hard surfaces like plastic and stainless steel. But really, when it comes to food and food packaging materials, we don't have any reports of this being a route of transmission. There's a basic principle that respiratory illnesses are not transmitted via food or food packaging. That's not really a route for the virus to be transmitted. And certainly the potential survival in the food environment, the whole premise of what we need to do is to keep the virus out of food out of the food environment, and that really should be the focus of controls. Upgrading sanitation, cleaning of food contact surfaces, hand washing and so on. Those are really the key messages that we should be giving to staff to protect against the transmission of the virus. Can I have the next slide, please? Really, when it comes to food workers, they need to be aware of the symptoms of COVID-19. And we already have, as part of the prerequisite programs for hygiene in food processing establishments, we have fitness to work protocols. When somebody is ill, they can report that they're sick, and they should be excluding themselves from the work food environment. We really have to reinforce those measures now to ensure that, number one, food workers are aware of the symptoms of COVID-19, and at the earliest possible stage, if they are infected, to report in and exclude themselves from the work environment, so that they're not really a risk of transmitting the illness to other workers. And really reinforcing the fitness to work protocols is really key. We want to minimize the risk of transmission in the workplace, and again, the way to do that is physical distancing within in the workplace, making sure there's sufficient distances between workers, hand washing, and also sanitizing of the food contact surfaces within the work environment. Now, we're aware that in some food processing environments, let's say in things like slaughterhouses, that workers really can't, they have to work closer than 1 meter apart. In such an environment, workers need PPEs. They need to have protective personal equipment. They need to have gowns. They need to have masks. They need to have gloves, boots, and so on. All the measures that we have at the present moment, when we are applying good principles of hygiene. where in some cases you can slow up production lines to space people out a little bit further along the production line or the processing line. You can stagger people on either side of production lines so they're not, you know, facing each other. But really, there's an awful lot of common sense is going to have to apply, you know, in order to introduce measures to reduce the transmission in the workplace. Can I have the next slide, Sarah, please? Yes, the use of protective, personal protective equipment. We've seen a lot of information circulating both in social media and in the press about the use of face masks, the use of gloves and so on. Certainly, when it comes to food processing and when it comes to retail, certainly some of the activities in those sectors, staff routinely wear gloves and wear masks, but again, it's reinforcing the basic principles of changing these frequently, of not using, you know, making staff aware of the protocols for using gloves in terms of hand washing, the fact that, you know, you can get a buildup of bacteria, you know, on the surface of hands under gloves. You know, and you don't want this false sense of protection from using gloves or face masks. Physical distancing, I've already mentioned. Transport and delivery of food ingredients. I mean, say this is an area for the food industry to increase biosecurity, you know, really on-site security for receiving of goods. Issues like when the driver, you know, comes onto the premises, they stay in their cab, they're not allowed out of their vehicle. Sanitizing hands when passing out delivery documents and so on. You know, all these practical measures really have to be introduced to ensure that you're not taking this bug into your food premises, that you're keeping it out. And really, again, that's the whole focus, you know, of the measures we're talking about, trying to keep the virus out of the food processing environment, and if it gets in, to minimize the risk of transmission. Next slide, please. Probably the biggest challenges faced in any of the food sectors, you know, during this pandemic is with retail food premises. This is, you know, a real challenge in terms of, you know, you can train your own workers, and so on, but really you're dealing with the public and, you know, with people coming into your store and interfacing with your staff, and really this is a huge challenge. In terms of where you can, you know, protect your staff, certainly when customers are coming in to the store, to ensure that there's a queue, to ensure that they are physical distancing, ensuring that shopping carts and trolleys and baskets are sanitized. I think you're going to have to allocate this to one individual or to two individuals to keep sanitizing trolleys outside your store, making available sanitizers for customers to clean down and sanitize the handles of trolleys. You know, there are a number of measures that can be actually taken, and these are reviewed in the guidelines. But I think a lot of these principles are already in practice in many of the large supermarkets. Hand washing and sanitizing, looking at the high touch points, really, you know, you will need to do a risk assessment to really identify those areas that need to be cleaned on a more frequent basis, and again assign this to a staff member to really frequently clean and sanitize these areas. Managing physical distancing and regulating customer numbers, whether they're coming into the store, whether they're queuing you know, at cash registers. The open displays of food, you know, there really is, from the consumer perspective, they perceived as a large risk associated with open displays of food. When it comes to foods like fruit and vegetables, look, we've always maintained that washing fruit and vegetables prior to consumption and washing with potable water is sufficient when it comes to fruit. With vegetables, you'll be peeling vegetables, you'll be cooking them, that will ensure that this virus would be destroyed. When it comes to things like bakery products, it's probably best during this pandemic to not to sell loose bakery products, to make sure that they are covered with perspex or plastic, you know, to ensure that you know, you will not have a transfer of the bug onto bread from consumers, from, you know, if consumers have the bug on their hands. So, and again, it's from a pure you know, sanitary viewpoint, not to sell loose bakery products. Can we have the next slide, please? Staff canteens. You know, a lot of restaurants have actually closed. They're no longer operating. They're selling takeaways and so on. But certainly for food workers, staff canteens are you know, essential to keep the whole business running. So they need to remain open. But again, physical distancing of staff, using those regulating staff numbers, going into the restaurants. If you can have things like shifts, where you organize workers into smaller groups or teams, and that way you can protect against the you know, the spread of infection if somebody does come into your store. I didn't mention, but the guidelines also have direction on, if you do have somebody, you know, ill in your food processing environment, there's protocols for that person to leave the environment, and that's covered in the guidelines. But again, hand washing and respiratory etiquette, coughing and sneezing in staff canteens. Again, making sure that staff are aware of how the bug is transmitted, making sure that there's plenty of information available in terms of posters and so on, and have somebody sanitizing and disinfecting surfaces in the staff canteens. That's a very quick summary of what's in the guidelines. And I think that the whole premise, I mean, say the basic issue is keeping the virus out of your food premises, making sure your staff are healthy, you know, having a fitness to work protocol in place where all staff understand this, that they do exclude themselves at the earliest possible stage, and then all the measures that you can take in the work environment in terms of cleaning, in terms of disinfection, in terms of sanitizing, and hand washing. I mean, say those are the, if you like to call it, the tools that are available to us to minimize the transmission and spread in the work environment. I mean, it's essential that we have a healthy workforce. If people start to go down with this illness, we're in serious trouble. That's everything I want to say. We can go on to the questions that have been submitted so far. Sarah?
Thank you so much, Alan, for sharing this helpful overview of the guidance. We do have a lot of questions that have come in prior to the webinar, and we would like to take some time now to review these. So what I'm going to do is I'm going to read out the questions, and we are going to then, Alan and Peter are going to try their best to address them on the call. We have approximately 30 minutes to do this, and if we don't get through all the questions, we'll consolidate with those that are coming in the Q&A function and try to feed them into a Q&A that we can post on the web. So let's start. We have a question a set of questions that came in from the Dole Food Company. One of the challenges we are seeing here in the United States is the availability of masks for use in processing plants. We have some areas in our salad plants where finished product, which has been washed but not yet bagged, is exposed, and per our normal protocol, these employees who must work over this food, because they are packaging it in clamshell containers or adding salad dressings, are required to wear surgical style masks to protect the food. We are increasingly having a very difficult time procuring masks, as obviously the immediate need for companies making masks is to ship to the healthcare industry. Are there non-disposable alternatives, such as cloth masks, laundered daily, which would be acceptable alternatives in food processing?
Sarah, it's Alan here.
Yes.
Can I have a go at answering that question?
Please do.
Look, I would say cloth masks, cotton masks that can be laundered, that can go through, a laundering system at 60 degrees or above, and then, dried out, again, hygienically. They can be reused. I think the reuse of disposable masks is unacceptable. They will become a source of contamination. But I think the cotton masks, if they are available, if you get them manufactured specifically for yourselves, I think they would be perfectly acceptable to use. But again, you want to exchange them. You want to change them, fairly frequently for food workers. Okay.
Thanks, Alan. Peter, do you have anything to add on that? Peter, I think you're on mute if you are trying to speak.
Yes. No, I was addressing. No, I'm fine with what answer was given by Alan. Go ahead.
Thank you, Peter. So another question that we have has come in. Do you think that people in Southeast Asia are partially immunized with contaminated food against the coronavirus?
Again, Sarah, it's Alan here. The answer to that is no. This is a new virus. This is a novel virus, and it's not. We don't have any immunity to it, and certainly, people in Asian countries would not have any immunity to it either. So I mean, say the premise that if you are exposed to low levels of hygiene or contaminated food, somehow or another, this is going to boost your immune system. I don't think that's true. It's a novel virus, and we're all at risk of infection.
Thank you, Alan. Another question. Often sanitizing and disinfecting are used interchangeably, yet these are two different things. What are the recommendations during these times for cleaning / sanitizing / disinfection of food contact surfaces and non-food contact surfaces? And would these protocols or recommendations change when there have been 0 cases of COVID-19 within the employee body, or when there have been 1 or 2 cases?
Can I take that first part of the question?
Please.
Look, I think everybody is aware of cleaning, sanitizing, and disinfection, and the systems that we have, already for carrying out these activities. The same principles essentially apply. We have, I mean, say cleaning involves using a detergent to remove physical dirt and so on. After cleaning, you can sanitize using a sanitizer, and really the type of sanitizers we're talking about here that are effective against this virus are alcohol-based and probably 70% alcohol or above. Disinfection, you know, as everybody knows, it's to try and kill off bugs using, you know, disinfectants, you know, things like based around chlorine, like bleach, diluted bleach, and so on. So all of the same principles apply. This bug is no more resistant, you know, than the normal run of bugs when it comes to cleaning, sanitizing, and disinfection. So food contact surfaces should be cleaned initially and then sanitized. The non-food contact surfaces should be cleaned and disinfected. When you have 0 cases in your you know in your work environment, you're lucky. You want to keep it that way, and certainly, you know, all your effort should be on keeping the bug out of the environment. If you've had cases in your in the work environment, again, there's protocols written for number 1, staff members that are infected to leave, and secondly, to sanitize and disinfect areas where they have been. So it means it's a matter of identifying the areas where they have been working, and you know, some staff members using protective personnel equipment like gloves and boots and so on, face masks, should get in and clean and disinfect those areas. But again, the whole focus should be on trying to keep the infection out of your environment. Thank you.
Thank you very much, Alan. So we have some questions with regard to the 1 meter distance, and I know you touched on this briefly in your presentation, but what can be done when that 1 meter distance cannot be respected in production?
I think the best thing to do is to give staff protective equipment like face masks, gloves, visors. You know, these are available in slaughterhouses. These are available, you know, when you know, people are working in retail environments, serving customers, working in areas where you have high risk areas where you're dealing with cooked products, ready to eat products, and so on. And I think most people on the line, you know, understand those basic principles. But certainly, when you cannot have this physical distancing, well, then you have to introduce, you know, additional protective measures to safeguard the health of your employees. Thank you.
Thank you, Alan. So we have a question. If there is a COVID-19 patient that has been identified and that person was working together with others in a small processing room, how long would it take for other people to show symptoms? So something about the incubation period and the contacts.
Peter, will you take that one?
Peter, yeah. Peter, I'm sorry, you're on mute.
Yeah, no, I'm struggling with my my mute button. Sorry. So I wasn't hearing you clearly. Can you repeat it?
Sure. So the question was about whether if there was a case identified in a processing plant, and this person worked closely with others. Will the other people get infected? Possibly, but how long would it take before these people showed symptoms?
That will be probably the same situation you will have out in the community or in other places where transmission is happening. From what we know so far, you don't get infected just by passing by somebody who's symptomatic. It takes a little bit of close contacts and for the possibility of inhalating or receiving the virus from somebody who excrete the virus. So if the person has been symptomatic for a while in the factory with close by co-workers, yes, that could happen. If it just has been a few minutes or even less, then the risk would be minimum. But as per current protocols in most countries, those other co-workers will be probably considered as contacts, and will have to be isolated for 14 days to see if they develop symptoms. And of course, the patient, the confirmed or the symptomatic employee will have to be removed as per current procedures.
Thank you, Peter. We have another question about whether the transmission of the virus is affected by higher humidity environments.
A difficult question to answer, but with respect to transmission in high humidity environments, in high humidity environments, you're going to have more water droplets, water vapor in the air. So these would probably act as a barrier, if you like to call it, when a person coughs or sneezes. But again, this is hypothetical. I don't think this work has been done. But again, just applying what we know, I think it would be, if the coughing and sneezing, the virus would travel not as far as it would in a dry environment. But again, that's speculation.
Thanks, Alan. We have some questions coming in about the persistence of the virus on particular surfaces. Is there any evidence of how long the virus persists on the surfaces of both food and food packaging materials? And has there been some assessment of the impact of this route, if any, compared with person-to-person transmission?
Well, I think looking at the data we have to date, certainly person-to-person transmission is the main route of transmission. We don't have any reported incidences of the virus being transmitted in food or on food packaging material. Now, we do have, one or two publications. One particular one that identified that the virus can remain for 72 hours on plastic and stainless steel, that it can survive for about a day on cardboard, it won't survive on copper surfaces. But if you like to call it experimental work, was done under laboratory conditions. One single, if it like temperature, humidity, extrapolating that to all food surfaces, I would advise caution. It's very difficult to do that and to be very general. So I think the whole emphasis, again, going back to the control measures that we are recommending, is to ensure that surfaces are cleaned on a very regular basis, they're sanitized, that you don't have workers who have the symptoms working in the food environment, that they are coughing and sneezing over the food. So you want to prevent this happening rather than trying to deal with it. And again, excluding customers who are ill from entering the retail premises. That really is the focus of all our controls. But in comparison to person, the likelihood of this being a route food and food packaging is minimal. Thank you, Sarah.
Thank you, Alan. I guess similar, sort of along the same lines of what we've just discussed, there was a question about disinfecting the surface of packaging material before taking it into the domestic environment, particularly for people that are at higher risk, such as the elderly. So if the risk is minimal, then...
Yeah, the risk would be minimal and probably not necessary. I think the advice to consumers really is to wash hands before shopping, ensure that the surfaces you come in contact with during shopping, are clean, are sanitized, like baskets and trolleys and so on. Ensuring that during your shopping experience, you're not touching your hand or your hands touching your mouth, your nose, and so on, all of those different precautions. And when you get back home with your shopping again, the first thing you do is to wash your hands, you know, and then you can unpack your shopping. But you know, I would say those are the broad principles you should be following. The idea of sanitizing, you know, all shopping is probably not necessary. Thank you.
Thank you, Alan. The next question is specific to dry food manufacturing facilities, where dry cleaning is the principal method of routine cleaning. What routines of cleaning should be considered for dry filling environments?
I think, you know, companies that are handling dry foods, such as, let's say, baby food manufacturers, you know, filling containers and so on, they already have, you know, hygiene and sanitation protocols in place for those specific environments. Again, the focus here should be on keeping workers out of those type of environments that show symptoms of the illness. So I mean, say that really is key. The organism itself, you know, in the unlikely event that somebody with the illness actually enters that type of a food environment, and coughs and sneezes and so on, we don't know, you know, how long the virus will actually remain, you know, in that type of environment or on those type of food products. But probably wouldn't remain very long. It would become dehydrated very, very quickly. But again, that's all speculation. You know, my advice to you know, those type of companies is to have a strict protocol in place for fitness to work, ensuring that the bug, the virus, is not taken into those type of dry food environments. And that's probably the best you can actually do. Thank you, Sarah.
Thank you, Alan. Somebody has heard about the use of hydrogen peroxide vapors for environmental decontamination events. Do the panelists have a comment on this?
That's a very that's a very extreme form, you know, of cleaning. Probably not advised for food environments. Hydrogen peroxide vapors, and as well as acids, would be probably quite dangerous. So I would say not advised for a food environment. I mean, say there are plenty of other alternatives, you know, available in terms of disinfectants, in terms of cleaning and so on, but such an extreme, I wouldn't say it's necessary. Peter, I don't know if you would have a comment on this.
Yes, no, I agree. I think the key message is that this virus is not much more or resistant than others, and the current procedures and system in place should be able to take care of this virus. What is important to remember is that special care, as you mentioned earlier, special care should be given to surfaces where a lot of people are passing by or touching, because these are the ones most likely to be contaminated by somebody carrying the virus. And that can be done with again, normal surface procedures. This is not a bacteria, so the virus will not grow in the processing environment. It may at best persist for a few hours and maximum few days in certain environment and on certain surfaces, but it's not going to establish itself in the environment like a bacteria would do. Yeah, the key message is that existing cleaning and disinfection procedures should be applied, would be perfectly appropriate.
Thank you, Peter. So we have some more time that we can answer some questions from the Q&A. So I will switch over to those now from the ones that we've gathered through email. Kieran asks, I think it will be necessary to emphasize that sanitation procedures need to be antiviral and not antibacterial. I have been in many places where antibacterial sanitizers are used. Are they any good?
That's a very general question, but you know, in principle, you know, those that would be effective against bacteria would probably also be effective against viruses, and probably, you know, even more effective against viruses, because you know, bacteria will have you know, the actual cell walls, some things like spores and so on, where you know, viruses will be a little bit more exposed. But I would say, you know, generally speaking, there shouldn't be a difference. Would you agree, Peter?
Yes.
Okay.
Yes. Yes. It should be viruses, and not in particular those coronaviruses are easily destroyed by soap, by all kind of general sanitation procedures and products. So we shouldn't have any particular problem there.
Thank you. Kirsten asks, should we suspend or reduce the use of compressed air for cleaning during this outbreak?
Look, you know, you want to keep the virus out of your food premises. If the virus is not in your food premises, you can carry on as normal in terms of cleaning and so on. But it's under those conditions, you can carry on as normal. Keep the virus out. If the virus does enter the premises, well, then you've got to rethink you know, exactly what you're doing, like using compressed air. Okay.
Thanks, Alan. We have another question. Ozone generators have been proposed as a mode of disinfecting indoor environments. Do you believe that this would work?
I haven't seen any publications on the use of ozone, you know, as a method of cleaning or sanitizing or disinfection with respect to this virus. You know, again, I can't emphasize enough the fact that, you know, the focus of the controls will be trying to ensure that the virus doesn't enter your food premises, and really all the normal protocols you have for cleaning and disinfection, as you would have under the general code of practice on food hygiene, all of those would apply. We really don't need to go over the top and trying to invent all new methods. You know, hand washing, you know, with soap and water, you know, the simple things. So I don't think we need to start looking at new methods to try and disinfect food premises. That's really not required. The old systems that we have that have tried and trusted, and they're all covered in the Codex Code of Practice on food hygiene. Those are the principles, and those are the methods that we should be sticking to. Thank you.
Thank you, Alan. We have a question from Mamdu. If an operator was infected and then cured, can they come back to work by when? Are there any specific measures that are needed before allowing him or her to operate again? So maybe I can answer the first part and give our panelists a little break. I think WHO's recommendations are that a person is fit to return to work when A, all symptoms have been resolved, and B, following 2 negative tests at least 24 hours apart. Now, in situations where testing is not available, we do recommend that the person remains self-isolated for up to 14 days following the resolution of symptoms. This is a precautionary measure because as yet we still don't know whether there is a possibility that a person can remain a little bit infectious after the symptoms have resolved. And so we do say up to 14 days. However, some countries have implemented different measures and have a different time period for that 14 days, but WHO's recommendation is 14 days. Peter, I don't know if you'd like to add to that at all.
No, I think you made it clear. If somebody gets infected, they have to recover from the disease, and we know from the data we have so far that it can take several weeks. It depends on how long people will carry on with having the disease. Some are very mild and recover very quickly in a few days. Others have to go to hospital and will take longer. But the important thing is that once you are free of your symptom, if you are in a critical position or have to return to a critical type of work, it might be a good idea to ensure that you are not shedding anymore, and therefore a test would be recommended to ensure that the person is free of the disease. And it's also a recommendation, if the testing capacity is there, that's done systematically to make sure that people who recover and are really free of the disease and do not shed the virus anymore.
Thanks, Peter. Is there a study available about the persistence of coronavirus in drinking water products, especially if post-contamination takes place? Alan?
I can take that one.
Oh, Peter.
No, there are no studies yet on the persistence in water and other similar products. The only data we have is, I think, coming from the Netherlands, where the virus has been detected in sewage water. So that's the only data we would have in something similar to that, but we don't have any data on that yet.
Thank you, Peter. There's also another pretty general question about transmission during the pre-symptomatic phase, and do we know how long that pre-symptomatic phase is?
Will you take that, Peter?
Yes, I can take that one. A very, very important question these days with the discussion about when and where to wear masks. There is more and more evidence that some people can transmit before showing obviously symptoms. From the time a person gets infected to they have obvious symptoms, there is a kind of gradual change where you may have very mild symptoms without even recognizing that you have symptoms of COVID, because they can be very, very insignificant or very general. So yes, there is probably a potential for transmission in some cases before showing obvious symptoms. And there is a publication that came out a couple of days ago from Singapore where they have looked at their cases over time and studied them carefully and found, I think, around 6.5% of their infection were through pre-symptomatic or asymptomatic cases. So it does happen, and it should be taken into consideration, but it's probably not the main driver of transmission. Over.
Thank you, Peter. Another pretty general one. Is there a typical sequence of symptoms? What comes first? Dry cough, fever, shortness of breath? And can this help in early identification of illness? Is temperature monitoring of employees most effective?
Peter, do you want to?
Yeah, okay, I can take it. I don't think there is a clear sequence of symptoms. The symptoms vary tremendously. There is a whole range of different symptoms associated with COVID. Everything from fever, dry coughing, sometimes diarrhea as well, loss of certain senses like taste and smell have been mentioned as well. It's sore throats and the like. and in particular among the mild cases, which are the majority of cases, there is a wide range of symptoms. So, and I don't think they come in a sequence. So I wouldn't know about anything like that. And with regard to temperature, there has been a lot of debate whether monitoring is useful or not. Again, the problem is that some people will be carrying the virus and potentially also transmit the virus without showing obvious symptom and therefore without showing high fever. So it could monitoring of temperature of employees is probably not a bad thing in certain circumstances, but it wouldn't be a fail-safe, 100% sure way of monitoring and checking the employees.
Thank you, Peter. Mike asks, the CDC is advising ventilation of a facility for 24 hours if an employee tests positive for COVID-19 before disinfection. What do you recommend?
It may, again, what's practical. When an infected worker, is found to be infected in a work environment, yes, the recommendations is to ventilate such premises. But again, that may lead to closing down the premises for 24 hours while it is ventilated. If you can disinfect, if you can isolate the area where that sick employee was, if you can disinfect, if you can sanitize, and ensure that that has been effective, the food premises should be able to remain open and keep production going. I don't think it would be necessary to close a food premises if you did find, one worker that had the illness. I think it's essential to keep businesses running and to apply the general principles of hygiene and sanitation to clean such areas. Thank you.
Thank you very much, Alan. And I just want to say that there are quite a lot of questions about the specifics of cleaning different facilities, and WHO does have guidance on this on our website. If you search for the water and sanitation hygiene guidance in non-healthcare facilities, it does have some useful information, particularly with regards to specifics around the concentration of chlorine and that type of stuff. So I just wanted to direct people there, because we're not going to have enough time to really answer all the questions on the call, because we're now at the hour. So I will perhaps say to everybody that it's been really a great pleasure to have everybody on the call, and also to thank Professor Alan Riley hugely for being in the hot seat today, along with Peter answering all these questions. Peter and Alan, would you like to say anything?
Yes, Alan, go ahead first.
No, I think just to reinforce the message for food businesses is your number one priority is to keep this bug out of your food environment, and to make sure that you have the protocols in place for staff to report illnesses and so on. And then in the food premises themselves, I mean, say cleaning, sanitizing, disinfection of all food contact surfaces, identifying high touch points and so on, and trying to ensure for the retail sector that you keep businesses open and that consumers can have access to safe and adequate quantities of food. And it's a huge challenge, and really, the world is depending upon you to keep things going. So thank you very much for the opportunity to talk. Over.
Thank you, Alan. I would like to echo the same thanks to all of you. You have been more than 500 to join us today for this webinar showing the global interest for this issue in the food industry and among food producers. As Alan said, after the health sector, the food production sector is probably the most critical in this period. And so thank you all for contributing to ensuring a continuous and safe food supply to the world in this difficult time. And please forward our best wishes and thanks to your employees wherever they are for the hard work they are doing and for keeping themselves safe and keeping our food supply steady and safe. I've seen that you have, in the course of this hour, also sent us more than 100 different questions. We're going to compile them and answer them as best as we can and send that around to all the participants in the coming days. We will also, there have been a number of questions on the guidelines, where and when these will be available. We are in the process of finalizing the guidelines. This webinar was also an opportunity to get some more insight on the subject. As soon as the guidelines will be ready, it will be posted on the WHO website on the Corona page. And that's the first item you will see on the WHO website, which is www.who.int. Very easy to find anyway. And we will also, I think, Sarah, correct me if I'm wrong, share the slides. I think there was a number of questions about that as well. Thank you again. Over.
Thank you, Peter. Yes, we can definitely share the slides, and there will be a recording of the call available as well that we can share. So thank you for that. And thank you again, Peter and Alan. And have a good day, everybody.